And I want to begin this morning by thanking every organization who helped plan and helped us pull it off as a community, as a city. Among them are Marion County Public Health Department and IMPD, our city's DPW crews, as well as the concerted effort of the Indiana Sports Corporation, Capital Improvement Board, Visit Indy, Downtown Indy, and countless others. Going into this monumental effort, we knew that we would need to respond and react to the complications presented by the virus, an expectation that recent events have confirmed. But it is a testament to our extensive logistics and public health planning that our public health experts have been able to react and respond to potential spread so quickly and thoroughly. It is by that measure, along with many others, that we can call the 2021 NCAA Division I men's basketball tournament a clear success for the city of Indianapolis. But Indianapolis has never been a city that rests on its laurels. Today, we have quite a bit more to share about the city's continued efforts to increase vaccination rates and mitigation of the virus. Over the coming months, our city, and frankly, the country as a whole at large, will move closer to herd immunity. That, more than anything, will see us through to the final days of this pandemic. But mass immunity is only possible insofar as every community has access to and a willingness for the vaccine. That's why the city of Indianapolis and our community partners are determined to make that access and willingness a reality for every population throughout Marion County, especially those hit hardest by the pandemic. On March 27th, the city hosted a Spanish language vaccine sign-up hotline. In one day, that event processed 1,076 calls. I want to thank every organizer and every volunteer who donated their time to make that happen. Because of them, more Hispanic and Latinx residents will receive the vaccine, improving health outcomes in a community that bore a disproportionate share of this illness. Added to that, the Marion County Public Health Department is now accepting applications for the COVID Community Recovery Grant Program. This program, a partnership between the city, the health department, and the Resolve to Save Lives, will award a total of $1 million to community-based organizations. The funds will be used to promote wellness and recovery within minority communities. Applications are open now through the end of this month. To apply, go to marionhealth.org/community recovery grant. That's marionhealth.org/community recovery grant. I should also add that mobile vaccine sites are beginning to roll out in Marion County. The first was held a week and a half ago at Eastern Star Church. Stay tuned for additional future dates from the Marion County Health Department. And finally, 4 weeks ago, I announced the COVID Community Ambassador Program, an effort to enlist everyday residents in spreading reliable, fact-based information about the vaccine. And I'm pleased to report the response has been tremendous. Today, we have an opportunity to widen the scope of that effort with the Got My Shot citywide initiative. Got My Shot will harness the resources of local partners to provide social media and other fact-based content promoting the vaccination. Already, Got My Shot has the backing of over 20 corporate, civic, nonprofit organizations, including the City of Indianapolis, the Marion County Public Health Department, Eli Lilly and Company, and our own Indianapolis Colts and Indianapolis Pacers. But along with these organizations, Got My Shot encourages all residents who have already been vaccinated to share why you should choose to do so. You never know. Your story could inspire others. For my part, I got my shot on March the 4th because as mayor, well, I encounter lots of people in every part of Marion County. And while I myself may not be in the highest risk category, neighbors that I interact with might be. Further, by getting vaccinated, I play a small but important part in getting the overall population to herd immunity. That allows all of us to resume the activities we have had to forego over the past year. So please go to gotmyshotcampaign.com, gotmyshotcampaign.com to learn more and to share your own story to help inspire others to get vaccinated. Because we know that along with continued masking and social distancing, more shots in the arm will get us back in business quicker than anything else. So let's finish the job, Indy. Get your shot. With that, I'd like to toss things over to Dr. Caine for an update. Dr. Caine?
Thank you, Mayor. I would just like to begin by echoing Mayor Hogsett's thanks to my staff and to the many partners who made it possible for our city to host 98 games of college basketball over 28 days. NCAA leadership, and particularly our health partners from the State Department of Health, IU Health, and the IU Fairbanks School of Public Health at IUPUI. Without them, the testing and contact tracing protocols that allowed us to host these tournaments would not have been possible. As the NCAA tournament concluded in our city, we continue to work with event organizers and tournament leaders, engage in contact tracing efforts, and provide guidance on protocols, as well as conduct additional surveillance and spot checks in and around the downtown area, and enforcement actions were taken when absolutely necessary. There is no entity better qualified to lift up residents than the community-based organizations that already serve them every day. That's why Mayor Hogsett and I have partnered with the nonprofit Resolve to Save Lives, led by Dr. Tom Frieden, to provide $1 million in grants to community-based organizations working to address racial inequities in our COVID-19 response and recovery. The applications, I will reiterate, as Mayor Hogsett stated earlier in his remarks, are due by April the 30th. We have extended the deadline, and this will be reviewed by a diverse advisory committee with experts in public health, education, housing and urban development, and community engagement who are experienced working within Marion County. Now, we're inviting these community-based organizations to visit marionhealth.org/community recovery grant to fill out a simple online form, no more than 2 pages, that outlines details such as what is the COVID-19 related need in your community area? What are the key activities you're planning to address that need? And how will the requested funds be used? Directions for other ways to submit an application can also be found on the website. Now, we're going to provide orientations for any grant applicant, and they're going to be held online this week, which will walk interested organizations through the application and provide an opportunity to ask questions about the process. You will be able to call in if you don't have access to a computer or internet. These will be held in English tomorrow, April the 7th at 10 a.m. and Thursday, April the 8th at 6 p.m. And we will also have it in Spanish tomorrow, April the 7th at 6 p.m. So residents, you can sign up for an orientation by visiting our grant website at our marionhealth.org/community recovery grant. Now, just in a few minutes, I'm going to walk you through our current data. But before that, I would like to offer a very important reminder that we must remain vigilant in the ways we can continue to stop the spread of COVID-19 and bring the end of the pandemic within our reach. So what does that mean? You need to continue to mask up in public, regardless of your vaccine status. Continue to remain socially distant from those outside of your household. That is a distance of 6 feet. Continue to wash your hands when in public, especially before and after eating and drinking, and continue to help our neighbors access to life-saving protection offered by the COVID-19 vaccine. Like Mayor Hogsett, I got my shot on March the 4th, and I received the Johnson & Johnson vaccine. But I want to say it's worth reiterating that all 3 vaccines are currently approved for use in the United States. They underwent rigorous testing, and they proved to be safe and highly effective at preventing serious illness from COVID-19. Mayor, I got my shot because, one, I was very concerned about having any long-term complications and putting myself at risk for death as a result of the vaccine. I also was very concerned about my negatively impacting or spreading infection to my loved ones, my colleagues, the general public that I interact with so much. And so immunizations is probably the most important public health advancement that have extended our lives compared to any other public health measure, immunizations. So I want to encourage everyone listening today over the age of 16 to visit ourshot.in.gov or call 211 to schedule their vaccine appointment. Now, if you have unanswered questions about the vaccine, I'm going to be joining Ashkenazi Health and MD Wise tomorrow, April the 7th at 7 p.m. for Take the Fight to COVID. And this is going to be a town hall focused on addressing those questions, moderated by our own one and only Tina Cosby. And residents will be able to join via Zoom, Facebook Live, or just simply call to ask their questions. So visit mdwise.org MC Fight COVID to learn more. And now I'm going to try to walk you through the data. That's what's happening currently in Marion County. So if I can have the next slide. So one of the things that we are seeing now is we're seeing a slow increase now in our positivity rates for COVID-19. We had reached in early March as low as about 2.4 or 2.6 positivity, but we have slowly been increasing our positivity where we are now at a 4.1% positivity at the end of March. Next slide. Not only are we seeing a slow increase currently right now in our positivity rate for our community, which remember is the gold standard, we want to be 5% or less. We are now seeing a slow increase in our newly confirmed cases that are occurring on a 7-day, 14-day average. And we had gotten in early March again, we had gotten down to about, I want to say in the low 80s in terms of our confirmed cases, but now starting to see a slight increase up to about 123 cases through this week on a 7-day average. Remember that goal for newly confirmed cases, we want to be 35 or less than a 5% positivity for at least a minimum of 2 weeks. Next slide. So our ED visits are not quite doubling, but we are with people who are having symptoms of COVID-19, but we were flat for about 12 to 15 cases per day, or 12 to 13 cases per day. And we're now, through April the 3rd, we are now experiencing this past week up to 21 new cases a day on a 7-day average. Next slide. Our first-time hospitalizations are still increasing as well and sort of kind of maybe leveling off for persons who have COVID-19. This may be a testimony that being vaccinated is showing some improvement in preventing hospitalizations as well as death. So we're definitely going in the right direction in terms of the importance of vaccinations. So in our social distancing, our masks, and washing our hands. Next slide. We are fortunately so far, we're not experiencing any deaths, at least one death per day, compared to what we were seeing earlier in the month of March. And so that's of tremendous appeal to us, the fact that these factors are working so far to continue to have us not experience at least one death per day related to this COVID epidemic. Next slide. So this is of interest. So we have the new cases that are occurring per 100,000 residents in central Indiana. What the slide is showing is if we look at that middle column, you will see that we had 11 cases for Marion County, and we have slowly increased to 13 new cases per 100,000 population. And you're seeing like Morgan County, you're seeing Boone County go from 20 down to 11 cases. You're seeing Shelby County go down from 10 to 6 cases. And you're seeing to 5 cases. And you're seeing Hamilton County going down from 18 to 16 cases. But if you kind of look very closely at these graphs, you will see that a number of the counties are slightly increasing just more recently from their initial downward trend. And so, very important for us to try to see where this is going in direction. Next slide. If we look at the percentage of people who are positive, the community spread from a positivity rate, you will see that Marion County and Hancock County started out with the lowest positivity rates, and we have slowly increased up to 4%. And you will also see that Hamilton is going up by 1%. Boone has stayed pretty flat at 5%. Hendricks is flat at 4%. Morgan is flat at 4%, with Shelby, the only county that looks like it's going in the downward trend from a 4 to 3% positivity rate. But I think it's also important, next slide, for us to see how are we faring in the Midwest? How do we compare to the other larger cities in the other states? So if you look at that first graph on the left, you will see that Indianapolis has gone from 9 cases per 100,000 population to 12. If you look at Milwaukee, though, they've gone from 9 cases to 15 cases per 100,000 population. And Chicago went from 13 to 20 cases, but you've seen that Indianapolis only went from 9 to 12 cases, with Cincinnati from 12 to 13 cases, Columbus going up from 13 to 17 cases. Detroit is really significantly increasing, more than doubling in 2 weeks from 23 to 56 cases. And the only large Midwest large city is where we see Louisville actually going from 16 cases down with a downward trend. But despite all of that, the significance of this slide shows that both Louisville and Indianapolis currently, at the end of this week, have the lowest new cases per 100,000 residents. Next slide. Based on our distribution and what age group we're seeing confirmed with COVID-19 cases by the month, again, our seniors, over 10%, are seeing very few confirmed COVID-19 cases by month. This is a group that we have vaccinated the greatest from an age group standpoint. We also know that our 20 to 29-year-olds continue to be the largest group contracting COVID-19 cases by month. And we're seeing a slight increase in our school cases, but again, at that 19% of those students less than, or age group less than 20, over 75 to 80% of these cases are in our 18 and 19-year-olds compared to a younger age group, which I'll show you just shortly from now. Next slide. So this highlights the new cases based on residents by their school ages. And if you can look at the sort of turquoise, the very low graph, you will see that we're experiencing no more than 3 cases per 100,000 population on a 7-day average. If you look at both the K through 12 ages, we're seeing less than 8 cases per 100,000 populations. So basically, our K through 12, less than 5 years of age, we're seeing a significant decrease in the number of new cases. I'm happy to report we have no schools that are in the red zone currently right now, no schools in the orange zone. So from a community safeguard standpoint, our children are extremely safe as composed to if they were um, uh, not in person and out in the community. So we're being very steady and flat, providing those safeguards for our children in elementary, middle school, and high school. But we continue at the end of March to see a significant increase, the navy blue, the very top line of our college age students, whether they're college or attending college or not, that age group between 18 to 24 are continuing to climb in regard to our new cases. And if we look at our adult population, we are seeing an increase too between those ages 25 to 64. Next slide. So we're currently right now at 16.4% of our individuals fully vaccinated up through this week. Next slide. This is our last slide. If we look at it broken down by age group, you will see that between the ages of 65 and higher, over 50% of those age groups have been vaccinated. We have from the age of 50 to 64, we continue to have challenges where we need to have more individuals vaccinated. And as you know, we just recently, Governor Holcomb in the Indiana State Department of Health have released eligibility where anyone 16 years and older can be vaccinated. We have to continue to be aggressive, really encourage our friends, our loved ones, and our colleagues, and people in our social network to consider being vaccinated. It is so important to protect our community. We need to reach herd immunity in order to protect ourselves, especially in light of the new variant mutated virus strains that are now circulating and increasing in numbers, whether it's from United Kingdom, South African strains, other Brazilian strains, and we're now seeing a new variant called the California strain that are way more contagious and can spread more infection to others. And we have to be concerned slightly, will we start to see more severe complications related to these virulent strains? So it's so important that we protect our community. We're at a race right now, reaching that herd immunity before we see a widespread rate of those new mutated strains. And they have now been identified, of course, in every state in the United States. So I believe that should be the last of my slides.
All right, well, we will move on to questions. As always, please put your name and media outlet within the Q&A box, and we will try to get to as many as we can. First up, I think, is Leslie with the IBJ. 1 second, Leslie, let me mute you.
Hi, can you hear me?
Yep, we're good.
Okay, great. I have two questions. In speaking about herd immunity, it seems like different public health authorities have different standards for what that is. So when you guys are discussing, reaching herd immunity before the variants become more of a problem, what is the goal there? And what percentage of cases in Marion County are variants?
So my goal is it can be anywhere between the range of 70 to 80%, but I would feel a lot more comfortable if we reach 80% of our community being vaccinated, especially in light of the variant resistant strains. So 80% is my target for herd immunity.
Okay, next.
And do you know
go
what
ahead.
percentage of the cases in Marion County are of the variants, or like the numbers on that?
So I don't have the individual cases of the variants for Marion County. We do know that we've got over 100 cases of the variant for the state of Indiana, and we have seen at least actually all 4 different strains in the state of Indiana.
Thank you.
Next, we have Russ McQuaid with Fox 59.
And good morning, Dr. Caine. Taking a look at the statistics, are you concerned that we are seeing the leading edge of a surge this spring? And then linked to that, can you give us an update on the progress of contact tracing and whether or not folks who have eaten at St. Elmo in the last week, or folks who think they may have been in contact with this NCAA basketball fan who died of COVID-19, have anything to worry about?
So let me take the first question. Am I concerned to know whether there's going to be a surge? So, Russ, I think we're seeing a slowly increased rate of positivity. But I will also say, I will also say that it's kind of hard to know what causes these fluctuations in the data. When I look at our data, I can point out that the other counties around the state have had their indicators worsen by quite a bit more, and they have not been hosting, for example, the NCAA tournament, so that we're seeing an increase in our state and even in our surrounding states and our counties. But I'm hoping, because this is spring break, we can see more cases. We can also may see some more cases because of the virulent strains. That I'm hoping that we will have a milder and a lower surge based on how slowly we're seeing the increase. So yes, I expect now, based on these numbers, to see a surge, but because of the slowness of it and the lower rate of rise in the cases, we're expecting that we'll probably have a milder surge compared to what we saw in Thanksgiving and what we saw at the Christmas holidays. Now, back to the question I believe you asked me of St. Elmo's. Was it St. Elmo's you asked me the question?
Yes, contact tracing progress, not only to alleviate the concerns of anybody who was at St. Elmo's, considering the outbreak and the death that's been reported there, but also contact tracing with the NCAA fan as he passed through several locations in Indianapolis before returning to Alabama and passing away.
Okay, so I'll go first with the St. Elmo's risks of spreading COVID-19, possibly to customers and related to that. I can't speak on behalf of Hughes Culinary, but what I can tell you is that we're continuing to provide guidance and oversight to ensure the safety of all their staff and patrons, including providing free PCR testing for all staff, and we're monitoring the restaurant operations very closely. So we follow what's called the CDC guideline that defines close contact as someone who is within 6 feet of an individual. They're masked, but if they're masked and who are within 6 feet of an individual infected with COVID-19 for 15 minutes or more, then we're concerned about transmission to the customers or patron. Based on our investigation to this point, we do not believe that there was any exposure risk to the patrons under this guideline. Now, I'm going to move over to the Alabama student who died. Well, I think I've seen those news reports related to that case, and of course, my prayers are always with that young man's family, his friends, and all the Alabama fans who are mourning his loss. Due to HIPAA protections, though, I can't confirm or deny any details related to any specific case, but I will talk to you about what we have done so far related to those news reports. On Saturday, when we were made aware of the report, we reached out to the Indiana State Department of Health in order to reach out on our behalf to the Alabama Department of Public Health to identify if anyone in Indianapolis had potentially been exposed to COVID-19 by any Alabama resident. A handful of individuals who attended our NCAA games have been contacted regarding their potential exposure to COVID-19. We will be continuing to cooperate with the state of Alabama's contact tracing investigation. Thank you.
Okay, next we have Abdul Hakim Shabazz from Indy Politics.
Good morning. Two quick questions. Dr. Caine, any idea what's causing our slight increase in COVID-19 cases? Is it spring break since those 20-somethings? And for you, Mr. Mayor, City did a really good job with hosting the Final Four. What are the steps to kind of keep the momentum going, keeping downtown clean, keeping it safe, the whole 9 yards?
Well, let me just say that I think normally when you have an infection come into a community, you start to see the cases increase usually at least 2 to 3 weeks later. We started to see a slight increase occurring, at the start of our, I guess you want to say our madness. So we most likely our initial surge has been related more to the spring break, but I can also say I can't tell you from fluctuations that our mutant-resistant strains may be contributing to this. And we will need to see in about 2 weeks from now what kind of impact we may be receiving during this March Madness week. You have to remember that our numbers came down such a tremendous level that we sort of removed some of our restrictions in our last public health order. And weather's nice, gorgeous, more people out and whatever. So we just have to have always a continuous education, encouraging everybody to remain masked in public, 6 feet distancing, and washing their hands frequently. The mayor had a question to answer to. I'm sorry, Mayor.
Yeah. So Abdul, thank you for the question. This was a remarkable month for the city of Indianapolis. I can't thank all of the parties who were part of this team. There are so many city, state, and nonprofits that went into putting this tournament together. But this much is clear. We have proved to the world that we can responsibly host major events. That more than anything else is my takeaway. And it just goes to show the Indianapolis mantra of when we work together, we can accomplish great things. And in answer to your question directly, we continue to make that effort collaboratively with all of our partners to make sure that the NCAA March Madness tournament is a starting point for Indianapolis really coming back, conventions returning, the hospitality industry back in swing, and I look forward to the months ahead. Now, having said all of that, we have to get vaccinated. We have to get more people, more shots in arms. We have to continue our mask requirements and our capacity limitations. But as has been said, we can see the finish line ahead of us. We've just got to run through it. And that's what the city of Indianapolis intends to do.
All right, next we have Eric Berman with WIBC.
Hi, good morning. I wonder if you could elaborate a little bit, what one of you, on the grants from Dr. Frieden's group. Can you outline what kinds of projects that money will go to?
So the results to Save Lives will contribute about $300,000 to our $1 million mini grants. And they will look at how to do outreach for individuals to help them know where the vaccine sites are. They may be educating them about what materials or what documentation they may be required in order for them to get vaccine, depending on what sites that they're going to. They'll talk about and be able to educate about grants related to anybody, educating anybody in regard to the benefits of getting a vaccine. They'll also educate about just education about what the COVID-19 symptoms are and what they mean, and giving them an understanding about quarantine and isolation. So there are a whole host of different things these mini grants can do. You may have an organization that says, well, I'm going to help register people for the vaccine because they can't do it themselves. So my faith-based organization or my community-based organization may say, this is a day you can call us and we will register you for this event. We may help you with transportation, or you may be homebound and you don't know how to get someone to provide vaccination for you. So it's a broad wealth of different ways that if they can identify to us how we can address these health equity issues related to vaccine distribution in our communities, it's important. And they may identify barriers or challenges that we didn't even realize as a result of getting a mini grant. You know, they can do, like, they can talk to people in their community, focus groups, educational things. So we're excited about this partnership. And I think it's going to be huge and critical to have all these partners working collaboratively with us on getting us where we need to be as for a healthy community.
Okay, next we have Stephanie Wade from RTV.
Hey, good morning. My question surrounds the mask mandate. Does it make Marion County's job harder when surrounding counties are lifting their mandates starting today? You know, what does it look like? How do we survive in this new advisory versus mandate status? And how long you expect this to last for into the summer months, and what that might look like for people?
Stephanie, thanks for the question, and I'll defer to Dr. Caine as well. But, you know, look, I just want to reiterate, we are grateful to the governor for allowing local governments to make the best decision for our different communities and continue to monitor. We continue to monitor legislation at the General Assembly. As I said at the last update that we provided, Indianapolis and Marion County are just fundamentally different than the rest of the state. We have more people, and therefore we have a higher risk of spread. Today, our numbers are relatively low, even though we've seen as Dr. Caine reported, a slight uptick. They still remain relatively low, but we're definitely not in the clear yet. And as we see a measured increase in Marion County, we also see a measured increase throughout the state and in the cities that Dr. Caine identified in her presentation. Indianapolis is light years ahead of major metropolitan areas throughout the Midwest. So I think we can take some comfort that while we're seeing a slight rise, that it has been a rise that we can contain. We must remain vigilant. We must wear masks. We must remain socially distant. We must wash our hands often. And to sound like a broken record, you need to get your shot. Vaccination is ultimately what will put COVID-19 behind us. So, as has been identified earlier in today's conversation, the city is working hard with all of our partners on the Got My Shot campaign to try and convince everyone who may be hesitant to register for their vaccination. And all those things in conjunction with each other, I think, show that the days ahead of us are much better than the days that we have unfortunately had to endure over the last year. And I'm cautiously optimistic. But wear your mask, remain socially distant, wash your hands, and get your shot. And if all those things can be done, then I hope that the day will be soon rather than later that we can return to some sense of normalcy. Dr. Caine, I probably stepped on your answer, but.
So, Dr. Hogsett, I think you just did a tremendous job in answering that question, and I have nothing to add.
Okay.
All right. Well, next we have Sherry with the Indy Star.
Hello, Dr. Caine and Mayor Hogsett. I'm hoping, Dr. Caine, you can talk a bit about what efforts with contact tracing are made with other states and municipalities, given that there was an instance of a potential fan. I understand you can't talk specifics about that case, but you mentioned that you reached out to the State Department of Health. What concerns do you have about people who've been here testing positive in their home states or their home counties, and how are you going to ensure that there aren't additional news reports of people who are hanging out at the NCAA? And ideally they weren't at any of those places that were in violation of capacity. But what is the Marion County Health Department doing to make sure that there aren't other cases that could, eventually be turning this into a quasi super spreader event?
So let me just say that any entity like a state department of health or even a local health department, if they've identified someone or it's been reported that someone is COVID positive, they have what they call an investigator or contact tracer person that does a case investigation. And they look to see any major events. It's just part of their investigation. Have you been to any major event, like within the last usually 16 days? And so based on that information, a lot of times they will report that to us, but sometimes contact tracing can be complicated, especially if someone is attending a college or university, meaning that when they get tested, they may give their home address if they're living out of state, as opposed to a college or academic address. So I can get my test, but my results go to another state where I grew up, and not necessarily to the state that I'm currently primary living for a while. So it can get a little complicated, but we do have a good system. And then once different parties are working closely together, we're trying to be very good about sharing information, sharing any additional information that may require us to do further communication for people at risk. We've had a great system here with our control environment, and even anybody, for example, who might have attended the NCAA event, we keep information related to who's seating, where is an individual being seated. We have their email information, we have their phone information. So we have the ability that I can look and say within a 6 feet diameter, or even going as far as 12 feet diameter, that I can generate a list of those individuals surrounding anybody that may have been infected as a spectator in some of our events. And that's extraordinary. You don't see this frequently in big events who have the capability of doing that. And so instead of me having to send a letter to every person that might have participated in a large NCAA event, I can tell, based on the information that we've gathered and all this extensive amount of pre-work that we have done, that we can do very effective contact tracing.
All right, thank you, Dr. Caine. Looks like our last question will come from Tom Healy from Indie Midtown Magazine.
Thank you. Good morning. Dr. Caine, the medical literature I'm looking at suggests that aerosol dispersion is of particular concern with the COVID-19. And I see you've made some general recommendations about ventilation in the public health order. I wondered, are you thinking or looking at getting perhaps more specific for enclosed spaces like schools or offices, places of worship, bars, that sort of thing, to give some guidance about how to keep airflow optimal so that it reduces the amount of aerosol transmission?
So let me say that I think in my public health order that we have some specific specifications about what we expect from a ventilation standpoint, how frequently the air is recycled in the air in terms of good circulation to help prevent transmission of COVID-19. And so I don't have the public health orders in front of me, but we had our director of occupational safety look and do the evidence related to this, and looking at the best recommendations, best practices from the industry related to this is how we came up with our specifications. And we have definitely, in our schools risk mitigation plans, have had them tell us about what their ventilation specifications are, how annually do they inspect their ventilation system, which is required once a year from us. So we've really been trying to push that out, not only for the school systems, but businesses as well.
All right, well, it looks like that's all we have for today. Thank you so much, everyone, for joining us. If you have any additional questions, I know we didn't quite get to everything, feel free to reach out to the city or the health department. Either Mark or myself will be available for follow-up questions, and we will send out a copy of the presentation afterwards like normal. So thank you so much, and we'll talk soon.